CHEC were after a single platform to automatically track their medical consumables, their high-value assets, and also the people, patients and staff across their estate nationwide. Integration was also a key requirement.
CHEC was founded in 2012, where we started with just one hospital. Fast forward to today, we've got 35 hospitals and over 120 community sites. So that's a lot of growth in a really short time.
Managing stock across more than 30 hospital sites in the UK is no small task. That's the challenge CHEC brought to us. They needed a reliable stock management solution so that they could have visibility into what stock levels were at each of their 30 plus hospital sites. A traditional barcoding stock management system was not going to work for them, as it's just going to be too time consuming.
So the clinic spent 292 hours a month counting stock. It was mainly just me counting in an Excel spreadsheet. 292 hours is the equivalent of just under 1,200 cataract surgeries.
It takes up a lot of time and conversation really within the clinic. If we don't have the stock, we can't see a patient, so it would lead to patient cancellations and obviously very unhappy patients if we're cancelling last minute due to stock. We had a look around to see what technologies were out there, and we got in touch with Zebra. We established that RFID technology was the way forward.
The ideal solution was a combined fixed and mobile RFID solution using Zebra Technologies and TAG-Works software that auto updates stock to give their head office the accurate visibility into what each site had in stock.
It was really important that we found a partner that could bring everything together and act as a solutions provider to ensure that we could roll this out into our business and provide us exactly with what we needed. We've found a lot of solutions along the way, whether it's with TAG-Works or TEC-RFID. We've kind of grown together through it.
Most of the platform was plug and play, and during the sales cycle, we could show how we could print and encode RFID labels, how we could connect and configure Zebra fixed readers as well as mobile RFID, and how they could create any number of data fields to match their data schema. But there were a few key points that we developed as part of this project.
I think straight away we kind of realised how knowledgeable they were, and we found ways to improve, we found ways to develop the software which is beneficial for everyone.
Firstly, we added serialization, and this means that TAG-Works can assign a unique serial number to each item in their supply chain. We then expanded our locations and min-max rules to be site level based. And thirdly, we developed a rules engine, and this makes sure that TAG-Works could match CHEC's workflows to make sure that inventory levels are accurate across the estate.
We can see from the TAG-Works software what we've got in stock, so it has had a massive kind of impact on how they work every day.
We can cut down the amount of stock that we're holding by 50%. All that capital that can go into other departments, it can extra staff, it can be used for what it should be used for, which is patient care.
For the clinical staff, it's really nice that they can actually spend all their working hours interacting with the patients.
If we put on more surgeries, then obviously the waiting times decrease, revenue increases. When 35 clinics go live, there's going to be 20,000 items in the hub. With RFID, it does all the counting for me, and I can simply just go on TAG-Works and see what I've got, what I need.
CHEC is using ultra-high frequency passive RFID. It can read hundreds of tags per second, even if those tags were inside of a cardboard box. That means CHEC can have antennas dotted across the hospitals, and every time an item goes past one of the antennas, the location of that item is updated. We are able to track on a tag level the expiry date, the batch number, and other information such as the purchase order number. And that's very powerful for reporting.
I can get a live view of what's in the hub.
With this system, the stock is managed centrally by CHEC, so we will always have a kind of stock, so we're not relying on external suppliers, therefore patients shouldn't have any kind of short notice cancellations or anything. We've found ways to improve, we've found ways to develop the software which is beneficial for everyone.
We spent a full week in one of their hospitals and we tested the reading performance across their medicines and also across their healthcare consumables, and we found that with the right kind of configuration and antenna placement, we were able to read the tags at a very good read rate. Reliability is really important for a healthcare setting. We've spent a lot of time fine-tuning the RFID settings and the power levels of each antenna to ensure that the system works in a reliable way.
It is streamlining the business, and this is just the start of it as well. A plethora of opportunities that we can expand using RFID, and it's exciting.
They knew they were going to be one of the first private hospital groups in the UK to adopt this technology, and they knew they had some operational changes that were needed in order to make the project a success. Our combined RFID solution helped CHEC gain real-time visibility and streamline their processes, and really brought their vision to life. We worked together to come up with quite an innovative bunch of new features which aligned with the vision of CHEC. And we found TAGworks very easy to work with, and their vast knowledge of RFID is evident.
CHEC is changing the way that healthcare is delivered in the UK, and we're proud to be at the centre of that innovation. TAGworks is continually evolving, and by listening to customers such as CHEC and partners such as Zebra, we're able to ensure that we're delivering world-class inventory and asset management into the AI era.